Mercy and WCPO want you to know more about how bone marrow transplants are saving the lives of patients at the Jewish Hospital. The Mercy Circle of Caring presents Healthy Ideas.
At Jewish Hospital, who is now a part of Mercy Health Partners, we would like to say that we are the only adult transplant facility in this region. And I would say that if you are in need of a transplant, or if you have a serious illness, some kind of cancer diagnosis like leukemia, lymphoma, or multiple myeloma, that you consider coming to Jewish Hospital, because I think we do an outstanding job of taking care of patients that have these diagnoses. And I think it's important to be able to stay in this region close to your family and friends when you're in need of a transplant. We have two types of transplants. There's an autologous transplant, auto meaning self. So a patient would come to our facility, donate their own cells, they would be frozen, and then the patient would be admitted to the hospital, have an inpatient stay, get high-dose chemotherapy, and then be rescued with their own thawed cells, with the hope that the cells would go to their bone marrow, start to repopulate, and grow new healthy cells. An allogeneic transplant is a little bit different. The process is somewhat similar, but the donor source of cells is not the patient. It's either an unrelated person or a sibling or family member. And so that happens, it happens to coincide with the patient being admitted to the hospital, starting on their chemotherapy regimen, and somewhere, either at Jewish Hospital, or it could be across the country, or it could be in another country, the donor is donating their cells, and those are sent to Jewish Hospital in a timely manner and then reinfused into the patient when it's time. The facility supports our bone marrow transplant patients very well. We have a great team of dedicated oncology nurses and physicians. We have a nutritionist, a few PharmDs, and then a great spiritual care team that consists of a social worker, clinical psychologist, and a ministry team. I think we all work together collaboratively to take care of the patient and plan and take care of their physical needs, emotional needs, and spiritual needs. There is always more to be done in the fight of cancer. So certainly we do some research clinical trials at Jewish Hospital. We participate in ECOG studies, which stands for the Eastern Cooperative Oncology Group, through Indiana University, and we are a member of the BMT-CTN, which is the Bone Marrow Transplant Clinical Trials Network, and through both of those organizations we're able to offer some research protocols to our patients so that we can find the best way to deliver the best care with the best regimens and have the best outcomes. It is so important for patients to have hope when they're going through their treatment. I think at Jewish Hospital we are able to help cheerlead our patients along the route, because it's not an easy route and it's not a quick route. And so I think the hope that our dedicated oncology nurses and physicians are able to give our patients on a daily basis is something that I'm very proud to be a part of, and I'm very proud to say that in Cincinnati we have this ability to deliver this. I remember one of my patients that has now been cured from his disease from transplant told me that Jewish Hospital blood and marrow transplant unit is the best kept secret in Cincinnati, and I think he's really right on the mark with that.
Thanks for visiting Healthy Ideas.